imbalancing of the fluids in the inner ear. This is external ear, this is middle ear, this is inner ear. So if there is a disturbance of the balance in the fluids of these tubes or this cochlea, then it can lead to a condition known as dizziness. I cannot balance myself, I feel I am falling, but fortunately it doesn't fall because the brain and cerebellum, they take care. In very severe cases, you can have vomiting and things like that. And the disease of these tubes is known as, and here is known as Meniere's disease. They must tell you in pathology. Okay. We have external ear, which is composed of a pinna. This is known as pinna or auricle. Auricle is a good name, scientific. Then we have a tube, external auditory meatus. It will finish at the level of tympanic membrane or tympanum or eardrum, all the names. So here is the boundary of external ear. Then we have a middle ear. Middle ear cavity is like a square, like this, rectangular. You enter into my ear, this is pinna, then you enter into a tube. After the tube, you will find an area like rectangular. It has an anterior wall, posterior wall, superior or the roof, floor, medial wall. What is the lateral wall? Tympanic membrane. Yes. So if I am entering from here, I will find this tympanic membrane, anterior wall, posterior wall, superior, inferior or roof or floor, medial wall and lateral wall. I will show you many pictures to explain this process and this. Once you know the basics, you will be happy. After this, you will find inner ear, which is like a snail. You know snail?
Yes.
Arabic?
Palazzo.
Okay. Very difficult for me. So it is a snail-like structure with 3 tubes on the back. We will explain to this. So we have ear, which is composed of 3 parts: external ear, middle ear and inner ear. External ear plus middle ear, with the help of some bones here, very small bones in the ear, it stimulates some cells here in the inner ear, which has 2 parts. This is related to hearing and this tubular system is related to balance. Okay. Again, nothing new. Auricle, external auditory meatus, eardrum. Eardrum yani tympanic membrane is also known as eardrum. There are many parts of the eardrum here, like for example, external ear. External ear, whatever I see here is the external ear, also known as auricle or the pinna. Auricle is a good name because auricular nerve, auricular vessel, so try to remember auricle. Helix, antihelix. 2, 3 or 4 important areas are you should remember. The first one is lobule. You should know the lobule because we have to do some blood tests from the lobule, even clotting time, bleeding time. Then here is tragus, here is antitragus. Then here is triangular fossa, here is scaphoid fossa, and remember the whole of it is made up of one cartilage. Okay, it is one cartilage in different shapes, and the cartilage is covered both the sides, out and inner, with the help of skin. You will find hair inside the auditory tube as well, or in the lobule as well. So that is absolutely normal. Okay. Then external auditory meatus. This is the meatus. Here is the opening. Here is the tube. Definition: it's 1-inch canal that conducts sounds from auricle. The function of this auricle and all these shapes is to help and conduct the sound waves to go in. Okay, all these shapes will help you to conduct the air sound waves. It is S-shaped in adults. It looks straight. So S is not like, S is like from here and like, S is not vertical, S is horizontal. So whenever I have to examine the ear for tympanic membrane or any other thing, I should make it pull back and laterally. So lateral and back. That will open the S completely and then you can enter and visualize inside. Understanding me?
Yes.
The tube is more straight in children. Okay, as we go up, it becomes S-shaped. Divided into outer cartilaginous part, which is related to the ear or the pinna or the auricle, and inner part, which is bony, of course, which is related to the skull. Impaction, impaction, here are some glands which secrete wax in the ear. The wax is a protective mechanism because it has a bitter taste, it has a bad smell for insects, so anything entering here will go a little back. Yes, brother. Also, it has IgA. Wax, I has IgA. So the bacterial protection is also there. So bacterial, viral, as the stuffy, the physical barrier, so it has a lot of functions. So, here is the tympanic membrane, this one. This structure is tympanic membrane.
The same thing, eardrum.
It's the same eardrum, tympanic membrane or tympanum, all same names. Clear? Okay, the tympanic membrane. Here now, tympanic membrane. What is tympanic membrane? Try to understand the structure and then I can read for you the material. Tympanic membrane is an oval structure, mujud where? At the end of external auditory meatus, when it is entered, the last point is external membrane. It has a fibrous ring like here. Oh, sorry. It has a fibrous ring like here to hold and attach itself. Then it is semi-transparent, not very shaffaf and not very kasif. So I can see through it if the ear is normal. So it's semi-transparent or semi-translucent. Here is the location. So this is lying at the angle of 55 degree with the horizontal, and it is oval in shape. If I see, there is a bone on the inner side attached, malleus. Okay, attached. The handle of malleus is attached here. So if I see from here, it is transparent. I can see the bone, and that is how you see it like this. If you put light inside, you will find a light cone-like structure. Cone of light is also there. So, what are the parts? Ring, annulus fibrosus. Then it has a bone visible, malleus, handle of the malleus. Then it has two folds. Here, a small anterior malleolar fold, posterior malleolar fold, which is longer in length. All the part below this two folds is known as pars tensa. Tensa, yani it's very tense. It's pulled by one of the muscles. I will tell you in a minute. This part is known as pars flaccida. This is known as pars flaccida, flaccid part. This is pars tensa, pars flaccida. Again, it's a layer, annulus fibrosus to fix it. Number one, the connective tissue layer. Then it has malleolar folds, two, anterior and posterior, here and here. The part below the folds is known as pars tensa. The part above is known as pars flaccida. You must have heard from the community that there is a rupture of membrane sometimes because of trauma or because of football injury, especially a football hitting you. So it's a very high air pressure. Most of the time, this flaccida is ruptured. Most of the time, flaccid part is ruptured. This is how we find the tympanic membrane. It is transparent. You can see inside here, for example, handle of the malleus, one bone attached to the inner side, or another bony part you can see also. Number two. Number three, if there is a collection, hemorrhage or blood, you will find a level. So this is also, it is visible on clinical examination. The examination is known as oroscopy or otoscopy when we have to examine the ear inside. So now I can read it for you. Oval semi-translucent gray membrane, easy. Side obliquely, I told you the location, roughly 1 centimeter. Surface outer concave, inner convex, and attached to the handle of malleus, which is also visible when you make the oroscopy or otoscopy. The area of maximum convexity is called umbo. This is like the membrane. If I enter my ear, you will find membrane like this. This part, the most pointed part, is known as umbo, U-M-B-O, umbo. Okay? You are seeing it from here, and you will find a bone here inside, and you will be able to see the because it is a translucent or transparent sort of a membrane. Clear things? Okay. It has 3 layers. When I say it has 3 layers, it means this is the membrane. Here is the auditory tube. So it has a skin. So 1. Here is the middle layer, so it has a mucosa. And then in the middle, it has its own structure, which is, so outer cuticular, yani skin layer, middle fibrous layer, which is the structure making the membrane, and inner mucous layer of the tympanic cavity. Clear? 3 structures. Okay. Then we have, I told you, pars tensa, pars flaccida. And arterial supply, nerve supply, you can read yourself, no, nothing to explain. This is how it looks like in an ear, in a normal ear, how it looks like, grayish. If there is no wax, if you want to see, go inside, see if there is no wax, or if there is a problem, pathology, de-wax the patient. There are certain drugs which will make the wax soft. You can suck this with some special instruments and you can see. Again, in the annulus, the handle of malleus, anterior fold, posterior fold, pars tensa, pars flaccida. Whenever you will find any image, you will find cone of light, because it's a transparent, and when you put light, it will have some reflection. So this is how you see a tympanic membrane. After tympanic membrane, I will start the middle ear cavity. Some say middle ear cavity, some say it's an air-filled space in the posterior temporal bone between tympanic and membrane and bony surface of inner ear. Let us explain. It's a narrow and oblique. This is you are entering into my ear, into the canal. After the canal, you will have a membrane. This membrane is a part of this cavity which has 4 walls, or rectangular. How? It has, this is my middle ear cavity of this ear. Anterior wall, posterior wall, roof, floor, medial wall, and the lateral wall is made up of tympanic membrane. The things are clear? I am going very slow. If we are late, we can take some of the lab part, no problem, in the theory. Okay, so how it appears? It is like compressed. It is like compressed. So the walls may not be like as straight as you think in this box. So we have to see the walls now. Bismillah. What is this structure? I am entering into the middle ear cavity now. So I am in the tube. I should remove the tympanic membrane and then I should see all the areas. So now I am inside the cavity. It has an anterior wall. It has a posterior wall. It has a roof. It has a floor. It has a medial wall. Now clear? Things are clear? Yes. What are the features on the anterior wall? Let's explain this picture. If you understand this picture, 95% of the lecture is clear to you. Okay? So, what is in the anterior wall? Here, anterior wall. It has 2 openings. Number 1, for a muscle, tensor tympani. Tensor tympani will come and, where is the membrane? Where is the tympanic membrane?
Blood forward.
Yes. So, here is the tensor tympani, here is the membrane. The tensor tympani will come and attach here to the malleus to make it tense. So name is tensor tympani. Understanding? So here anterior wall has 2 openings. Number 1, number 2. Auditory canal or auditory tube or Eustachian tube is the location is here. I will explain you in a minute. Just try to focus on the boundaries. So anterior wall has 2 openings and a canal. They say it has a carotid canal. The internal carotid artery is not attached to it, but it has an anterior relation to it. So 1, 2 openings and carotid. What is on the back? On the posterior, there is an opening. This is known as adytus. Adytus is any opening. Adytus to mastoid. Mastoid antrum. This is mastoid process. Here I have styloid process. Understanding? Mastoid process, styloid process. In between them is a stylomastoid foramen. And the facial nerve will get out of here. Where is facial nerve? In the posterior wall. It is covered in a bony part. It's not naked, not nude nerve. It's covered in a bony sheath known as bony facial sheath or bony facial canal. There is an opening from where the ear is communicating with the mastoid air cells. Like other pneumatic bones, mastoid also contain air cells. And here is the opening and the ear is communicating. So anterior communication is where? With the nasopharynx, auditory tube, Eustachian tube, and the posterior is with the opening is with the adductus to antrum and mastoid air cells. This is about the anterior and posterior wall. The roof. Here is the petrous part of temporal bone. It is related with a thin part to tegmen tympani. This part is known as tegmen tympani, which if is broken, the infection can go directly to the brain, meningitis. So this is in the middle cranial fossa. I will show you another picture in a minute. What is on the floor? This is known as jugular wall. Why jugular wall? Because internal jugular vein is very close to here. So anterior wall is sometimes known as carotid wall. Posterior wall is mastoid antrum with opening. Superior wall is known as tegmen tympani, and the inferior wall is known as the jugular wall. The medial wall, it has an elevation. It's like this elevation. This elevation is known as promontory. How promontory is formed? If I remove this promontory, I will find the cochlea. The inner ear is pressing here and it is making you a bulging structure. This is known as promontory. In relation to promontory, we have two openings: oval window and round window. What is oval window? Here is malleus, here is incus, here is stapes, third bone. It will fix on the oval window. This is the function of oval window. The round window is to neutralize the pressure. When the sound waves, they move all the fluids, it should be stopped. So on this region, secondary tympanic membrane, we have attachment of secondary tympanic membrane, which will neutralize all the waves again. Otherwise, you will keep on listening. So this is the mechanism to stop listening. Once I finish, you stop listening. Otherwise, you will keep on listening till Yawm al-Qiyamah. Okay? So these are the structures. Let me repeat it for you again in another picture to make your life less miserable. Again, I am entering into the middle ear cavity. I should remove the tympanic membrane and I should have this cavity, anterior wall, tensor tympani, auditory tube. Good? Relation with carotid. Not inside, relation only with carotid, anteriorly. Posteriorly, you have opening adductus to antrum, which is responsible for communication with the mastoid air cells or mastoid process. Then, the superior wall, tegmen tympani. Here is cerebrum, part of cerebrum, middle cranial fossa. Here, this is known as jugular wall because internal jugular is in relation. Anterior, posterior, superior, inferior. Then we have a medial wall. On the medial wall, you will find a bulging promontory. Promontory has a nerve plexus, which I will explain to you. Then there is oval window, there is round window. Oval window is for the foot plate of stapes, and round window is for attachment of secondary tympanic membrane to stop the oscillation of which is produced with the sound waves. Other some structures, there is a pyramid. Pyramid eminence, this is will give you another small muscle inside the ear. Here is the bony canal for facial nerve. Here behind you will find mastoid process. Here you have styloid process. In between stylomastoid foramen, this is the exit point of facial nerve. This is known as bony facial canal. The facial canal is a Z-shaped canal running through the temporal bone from the internal acoustic meatus to the stylomastoid foramen, internal meatus to the mastoid foramen, and it is approximately 3 centimeters long, which makes it the longest human osseous canal for any nerve. a bony canal. The longest bony canal for any nerve is the facial canal. Am I clear?
Yes.
Good. Now get out of the concepts how it looks like really. Now, what you see here is the external ear or the auricle, then you see meatus, then you see the middle ear. Where is the middle ear cavity? See here, middle ear cavity is this one. Where is the anterior wall? Here is the anterior wall. Communicating with auditory tube, here is the auditory tube or Eustachian tube. Where is the lateral wall? Here is the lateral wall with tympanic membrane. Where is the medial wall? This will make a curve here, promontory. So this is the medial wall. Where is the superior wall? Here. A roof, tegmen tympani. If this is broken or something, here is brain. So meningitis can take place. What is inside? You can see now one bone here, malleus, then incus, then stapes. Where is the oval window? Here is the oval window. So the foot plate of stapes will fix into the oval window. Where is the round window? Roughly here. Why? Because now it makes sense to you. If the sound wave is coming, this is oscillating. It will improve or it will stimulate the movement of malleus, incus and stapes, and all of them, they are there to increase the pitch of the sound. They will increase. Even small whisper, these will oscillate, move to and fro. Then it will give a pressure to the fluid, which is perilymph, then to a fluid endolymph. Here is the endolymph. Out of endolymph, the nerve will go to internal acoustic meatus and it will go to the bones. This is the pathway of hearing. Am I clear?
Yes.
What about balance, roughly? Here we have 3 tubes, 1, 2 and 3. I will give you the details of the tube in a minute, but just to take the concept. So here is 3 tubes. Once there is positional change in the head, see the nerve fibers from these tubes will make. So this is cochlear nerve, this is vestibular part for balance. Both of them, they will combine, make one nerve, and internal acoustic meatus, they will get out to attach to the pons, this part of the brain. Am I clear? Okay. What is the inferior wall floor? See here, floor with jugular. So in this picture you can see lateral wall, anterior wall, roof, floor. It is, the cavity is like obliquely placed like this. So if you have multiple pictures, only then you will see this is this wall, this wall. This is a picture which can show you maximum part of the ear. Am I clear?
Yes.
Good. This is made by Dr. Ramzan the Great. So again, what we see here, tympanic membrane. This is a meatus, sorry. This is eardrum or the membrane. After that we have malleus, incus, stapes fixing on the oval window. Then we have promontory. Here we have round window. Okay. So this is inner ear. This is external ear, middle ear, inner ear. Am I clear now?
Yes.
Good. Same, nothing new. Anterior wall, we have, I told you, opening of tensor tympani, opening of auditory tube, and in relation with internal carotid artery in the anterior wall. Here, auditory tube, muscle, and carotid. Carotid canal is like here. What is tympanic? Eustachian tube, auditory tube. A tube that extends from anterior wall of the tympanic cavity to the nasopharynx. You know, I told you in the nose there is a opening in the pharynx, nasal pharynx, then we have a tubal elevation, then we have a tubal tonsil. This is the area of nasopharynx, this is the area of the middle area cavity. Its posterior 1/3 is bony. So here it is bony, here it is cartilaginous. Anterior third is cartilaginous. Bony part begins anterior to the tympanic cavity as continuation of anterior wall, and cartilaginous parts end in the lateral wall of pharynx, nasopharynx. What is the purpose? Equalizes the pressure on both sides of the tympanic membrane. This is ear cavity, red one, middle ear cavity. It contains air. So pressure from here and pressure from here is balanced. That is the reason when sometimes flying in the aeroplanes you become suffering from blocked ear, or you become the ears are blocked bilaterally because of difference in pressure, air pressure. The Eustachian tube is closed. Then you make some, or they give you bubbles, chewing gums, then it can open. This is how the function of Eustachian tube. Just a quick revision. Anterior wall, posterior wall, roof. Now you know all the areas. Tegment tympani, jugular wall, anterior wall, posterior wall, promontory, oval window, round window, and the same picture like here. Plus you know all these structures. Okay. What is the boundaries and how what is formed? Roof is formed by tegment tympani, separates it from the temporal lobe. Floor, thin plate of bone separates from the internal jugular vein. Anterior, it has three canals. Try to remember three canals. Canal for tensor tympani, canal for auditory or auditory tube or tympanic Eustachian tube, and carotid canal. It is not in the wall, it is related to anterior part of the wall. Then the posterior, paramiddle eminence. Where is paramiddle eminence? Here. Here. Posterior wall. This is paramiddle eminence. Facial nerve canal, the longest osseous canal I told you. Opening of mastoid antrum. Opening of mastoid antrum. This is the features of posterior wall. Medial wall. Where is the medial wall? This is medial wall. Three big features are promontory, oval window, round window. See here. Oval window, promontory, round window. What is for oval window? Closed by the foot plate of stapes, helps in hearing, auditory. Promontory, bulges made by basal turn of cochlea. This is how promontory is bulging. And round window is closed by secondary tympanic membrane to stop the oscillation of the fluid. Tympanic membrane is the lateral wall of. There is something known as epitympanic recess. What is epitympanic recess? Here, see this picture. Yes, see this picture. This extra part here, bulging, this is known as epitympanic recess. This is an extra part. For example, if I say this is the cavity, this is the posterior wall, so here is some bulging. So this is known as epitympanic recess. No function, only containing air. Okay. What are the contents of middle ear cavity? There are two muscles. Tensor tympani, stapedius. This is tensor tympani. And I told you, here is the tympanic membrane. So it will come and attach to, this is the tympanic membrane. Here is malleus. So it will come and attach to the malleus to make it tense inside. Tensor tympani. Tensor tympani. Contraction pulls the handle of malleus medially, tensing the tympanic membrane. So name is like tensor tympani. Stapedius is another small muscle here. This one. Stapedius. Attached to the pyramid. I told you there is a pyramid on the back. Attached to the pyramid. Contraction pulls stapedius posteriorly. What is the net effect of these two muscle contraction? Both muscle limit ossical vibration to high pitched sounds. If you are passing and you hear an atomic bomb, you will die before it can help you, or it can help you before you die, I must say. To help out with high pitched sounds, these two mechanisms will get away from the tympanic membrane and the oscillation will be less. This is the function of these two muscles, therefore to protect the inner ear. Understand with me?
Yes, sir.
we have three bony ossicles. What we are doing, we are listing the contents of the middle ear cavity. So the first is two muscles. Then we have three bones. Malleus, this is handle of malleus. We have different parts, but in your objective we don't have the parts. So only try to remember handle of malleus. Then we have incus, then we have stapes. And this structure is known as foot plate of stapes. This all is known as foot plate of stapes, and it will attach to oval window. It will attach to oval window. So the first content is two muscles. Second, three bones. Then we have some nerves. Chorda tympani crosses the cavity medial to tympanic membrane and handle of malleus. This is chorda tympani. This is inside the cavity. Tympanic plexus here. Tympanic plexus found on promontory and formed by two main components, tympanic branch of glossopharyngeal nerve and sympathetic fibers. So where the sympathetic fibers are coming from, the internal carotid will give you some sympathetic fibers here. Then we have, it has branches like sensory branches and lesser petrosal nerve, sensory to middle ear, inner surface of tympanic membrane and auditory tube. This is the responsibility of this plexus to distribute and supply these organs. Another picture, another view to show you the chorda tympani. How this plexus, this is the location of plexus, promontory. How it is formed? By two main sources, tympanic branch of glossopharyngeal nerve. Here is pons, glossopharyngeal nerve, having superior inferior ganglion. Near the level of inferior ganglion, we have one branch, which is known as tympanic branch of glossopharyngeal nerve. So it is one. Another is here, the lesser petrosal nerve. All these are for the supply of the face and other. You must have done, I don't know or no. But how the plexus is formed, here is the location of plexus, and this is how it is formed. Arteries of the middle ear cavity. Blood supply of the middle ear. Four main sources, rather five main sources. This is the middle ear cavity. We have anterior, posterior, superior, inferior, and one extra. Anterior, first part of maxillary artery. Here is the maxillary artery. So first part of maxillary artery will give one branch here. Number one. Posterior tympanic branch of stylomastoid artery of posterior auricular here. Number three, superior tympanic branch from middle meningeal artery. Superior tympanic. And inferior tympanic branch from ascending pharyngeal here. And corticotympanic branch of internal carotid. Here is internal carotid and here is the branch. So middle ear is supplied by five sources: anteriorly by maxillary, posteriorly by posterior auricular and its branch, superiorly by middle meningeal, inferiorly by pharyngeal, and corticotympanic is the fifth branch, which is a branch of internal carotid. So this is what we have, the blood supply of middle ear. So, what are the contents of middle ear cavity? Air is the first content. Don't forget. Air. It contains air. Then it has two muscles. Then it has three bones: malleus, incus, stapes. Then it has four nerves, and it has five arteries. So this is the content of middle ear cavity. Am I clear?
Yes.
What we have done up till now: external ear, the features. Then I told you about the tube. Then I told you about the cavity. It has anterior wall with two openings, posterior wall with antrum, the superior floor with tegmen tympani, the inferior with jugular, the lateral tympanic membrane, the medial promontory oval window, round window. Khalasna. This is the middle ear. Plus on the back we have epitympanic recess. Am I clear now?
Yes.
You know whole of the ear. You think you are sitting inside the ear now. Good. We finished the middle ear. We finished external ear. I revised for you external and middle. Now I'm going towards the, okay, communications of the middle ear. And these are the sources of complications. Anteriorly with nasopharynx through the acetacean tube. And that is the reason when I have flu or nasopharyngeal inflammation, what will happen? The mouth, the opening will close and I will have a feeling of blocked ear. Sometimes during flu seasons, you feel blocked ears. So that is some secretion is entering into. The air is absorbed and you feel tympanic membrane is fixed. So this is one of a complication and depending upon the communication. Posteriorly with mastoid antrum. The Eustachian tube in children, in adults, the face is long, so it is like oblique. In children, it is straight because the face is small. When a child is sleeping and drinking some milk, there is a possibility that it will go from nasopharynx to the middle ear. And that is the reason the children have high incidence and prevalence of middle ear infections, including the collections. This is the problem. Posteriorly with mastoid antrum. So here is my mastoid process. So posterior cavity is opened into the mastoid. Any collection in the middle ear can go to the mastoid. So it can give you middle ear cavity leading to mastoiditis. This can happen. Then medial inner ear through the round window. So inside infection can go. Above infection can go to the cerebrum meningitis. So middle ear cavity is not a good area. It's a harboring, but it's well protected with tympanic membrane, so things are safe. Inner ear. What is the time?
38.
Okay, still. Inner ear. We finished this part. We finished this part. We finished the cavity. Now we are dealing with the structure. Snail-like structure. It lies in the petrous part of temporal bone. Here is the petrous part of temporal bone. It consists of bony labyrinth. This all structure is known as bony labyrinth. It is composed of three parts. Number one, cochlea, made of turns. Then this central part, which is known as vestibule. And then we have three canals. 1, 2, and 3 canals. So it is composed of bony labyrinth is composed of three parts. 1, 2, and 3. Someone is calling me, I think. Can you just tell him I'm in here? Oh, it's finished. Okay. So here is the bony labyrinth. It is composed of three parts: cochlea, vestibule, and semicircular canals. Now we'll see the details. Bony labyrinth, cochlea, vestibular, central, and semicircular canal posterior. Bony labyrinth. This is what I have enlarged it to show you the cochlea. It is bound around a bony structure like this. This structure is known as modulus. So here is the modulus. We have two turns and then a third, 3/4 of a third turn. Then we have vestibule. Then we have three canals. 1, 2, and 3. Two of them, they are vertical. The lateral one is horizontal. I will show you in the lab, inshallah. What is inside?
Beryllium.
Yes, it has a fluid. What is inside? We have a similar structure of membranous labyrinth. See here. First see this picture. This is bony, this is membranous. So in the cochlea, we have a tuber-like structure. Here in the vestibular part, we have two special structures, saccule and utricle, and we have three semicircular canals. The endolymph, another fluid is mojood inside this membrane. So we have a bony labyrinth which contains perilymph. In the perilymph, we have suspended membranous lymph, membranous structure, and inside the membranous we have endolymph. Understand it? Let's see. Bony labyrinth, it consists of perilymph. It contains perilymph in the membranous labyrinth. Vestibule, this is the vestibule. Semicircular canals, 3. 1, 2, and 3. Superior, posterior, and vertical. The latter one is horizontal. Cochlea, this is known as cochlea. Resembles the snail, and it is formed by central pillar called modulus, and around it a hollow bony tube which makes 2 turns and then more than a half of a third turn. Membranous labyrinth lies within the perilymph of bony labyrinth. It is filled with endolymph, and it has parts utricle and saccule here in the vestibule. Here in the vestibule, the cochlear duct in the cochlea, and semicircular canals here or semicircular ducts. In the bony part, we call this as cochlea, vestibule, and bony canals, 3 bony canals. In the membranous part, we call this as cochlear duct. Vestibule has 2 structures, saccule and utricle, and we call them as semicircular ducts. Okay. Where are these structures? This is middle ear cavity. After this is all inner ear. Now you can see some part. Cochlea, you can see on the back. Vestibular part is not very clear here. You can see only 3 semicircular canals. So roughly here should be the vestibule. Where is petrous part of temporal bone? Here. This yellow is petrous part of temporal bone. Where is the external auditory meatus? Here. So when I go inside, I will find the inner ear here. First I will find the middle ear, and then I will find the inner ear. This is how it looks like in the petrous part of temporal bone. We will deal with it in the lab also, inshallah. Functions. 2 functions at the start I told you. It has hearing function, auditory pathway, and balancing pathway. Auditory, what is the pathway? Sound waves come, vibrates your
Eardrum.
tympanic membrane or eardrum, attached to malleus, incus, stapes. Malleus, incus, stapes will stimulate the perilymph. Perilymph will stimulate the endolymph. Endolymph will stimulate the cochlea, which has some hair cells. You will know in the histology. These hair cells are stimulated, and the cochlear nerve is stimulated, and you ultimately form hearing with the cochlea. This is the pathway of hearing. For balance, the head movement stimulates saccule, utricle, and the 3 tubes, and the nerve fibers which get out of it. Like, see this picture first, will make one part of the vestibulocochlear nerve, and here is the second part of the vestibulocochlear nerve. It will get out of internal acoustic meatus and will go inside. Clear?
Yes.
Good. Again, the pathways are clear.
It's not objective.
Pathway is not the objective?
Functional or not objective.
Okay, so after whole of the structure, remain deaf because there is no function. Cochlear, vestibulocochlear nerve. Cochlear part, vestibular part. Cochlear part is formed by central process of the bipolar neuron of the spiral ganglion of the inner ear. They leave the petrous part through the internal acoustic meatus, and the fiber enter the pons to make the cochlear nucleus. Similarly, we have bipolar neuron in vestibular part, and they will also reach the pons like you see in this picture. See this picture. Here is the petrous part of temporal bone. Here is the external ear, middle ear, inner ear. Here is the internal acoustic meatus. So both the nerves will get here. Here is the pons. They will enter into the pons. How they appear is like this. This is cochlea, inner ear part, the cochlear nerve. This is balancing part, vestibular nerve, superior ganglion, inferior ganglion, and now it will make and exit through internal acoustic meatus and enter into the pons with fauna nuclei. Another picture just to explain you all the things. Finally, external ear, middle ear, inner ear. Inner ear, I just make it slight rotated to show you the similar shape and what structure you are seeing. Here is the cochlea with cochlear nerve, balancing part vestibular nerve with one ganglion, and both of them they make one nerve and they get out of the ear, internal acoustic meatus. We have some time? I just want to show you pictures only.
Just 4 minutes.
I will not explain. See this one? We will follow this. We will follow this. Pinna or the auricle, external auditory meatus, tympanic membrane, auditory tube, tensor tympani, some pharyngeal muscle, internal carotid, styloid process, mastoid process. I will just name them. I will show you in the lab, inshallah. Tympanic membrane, 3 bones, the part of the cochlea, vestibule, 3 ducts, nerves. And that's finished. Endolymphatic, there is how these secretions are coming. Perilymph and endolymph. I just make some few points here to make you understand. We can discuss in the lab. Thank you.
Thank you.
Understand?
Yes.
Alhamdulillah.
Good. How much?
Inshallah, we'll see.
Again, very quickly. External ear, meatus, middle ear cavity. Middle ear cavity, anterior wall, 2 openings. Tensor tympani, auditory tube. Posterior wall, additus to antrum. Superior, tegment tympani with cortex. Jugular wall for related to inferior jugular. Lateral wall, tympanic membrane. What is tympanic membrane? Oval, anterior fold, posterior fold, pars tensa, pars flaccida. Then, malleus, what is inside? You know air, you know 3 bones, 2 muscles, nerves, and 5 blood vessels inside the cavity. Then, after the cavity, you have the inner ear. It has 3 parts: cochlea, vestibule, 3 ducts, same like perilymph. Inside is perilymph, suspended a similar structure, endolymph, and you know the parts. Khalas na.
Alhamdulillah.
Thank you.
Thank you, Doctor.
Jazakallah khair. Hadratak, if you can take that. If you have some time.
Inshallah.